Welcome to part 2 of Psychoanalysis and Philosophy, Kant and Bion, Thought and Effect, the Manufacturing Process. So far in part 1, with our subject expert Dr. Himanshu Vaidya, we have covered a deep understanding of how Bion and Kant did their work in field of epistemology of thought and effect for psychoanalysis. Namaste, sir.
Namaste.
So we were discussing somewhere about the limitations of Bion and Kant and how it is relevant to our discussion today here.
Yeah, we were on to two important points. One was frustration and one was the infinity. So it's very important to grasp these two concepts. Frustration takes us very near to that nameless state. And there is a tinge of slowly that nameless state is populated or colored by a drop of anger and sadness. But the frustration is quite common. In a very generic sense, the moment a desire is not met, the first thing that comes is the frustration of desire. So that is very important. The second is infinity. Now, we were talking about this infinity. Now, the infinity in this context is very unique. It is like before the affect is manufactured, the mind has to think how much affect to manufacture. And for that, the situation has to be evaluated. And it is in this evaluation process that this infinity works. For example, let us say somebody humiliates me. Now, I listen to that humiliation, and in response to that humiliation, I have to feel sadness, anger, shame, desire for revenge. But how much of it to feel is based upon how I evaluate what I hear. Now, in that evaluation process, I go into what is my normal esteem level, what is my expected level of respect. And if I am humiliated by 1 unit, how much sadness and shame and anger should it generate? Which goes to my sensitivity and my evaluation process. In that evaluation process, when the infinity opens up, the disproportionate affect gets generated.
So is it like a threshold for the
I can't hear you. Can you repeat it?
Of effect?
I can't hear.
I said, is it, I asked, is this infinity a threshold, or is this infinity a quantum of containment of a person?
No, it is an element which mistakenly comes in the evaluation process of an event just before the mind decides how much affect is to be generated.
Because the term infinity is confusing me right now. So infinity is the extent of an element.
No.
Okay.
It's a multiplier.
Oh.
Let us put it this way. One person is humiliated in front of 5 people, and exactly the same way another person is humiliated. The first person, he feels humiliated, and in response, he experiences anger, sadness, shame, inferiority, and desire for revenge. But he is okay after 2 days. Because these negative effects in terms of the quantum generated were moderate. Another person develops a trauma out of it and has to undergo a few months or years of therapy to overcome that part. Now, what is the difference between the two? The difference is in terms of the response, affect generated in response to the same humiliation. So, when affect generated is disproportionately higher, one of the reasons can be, there can be many reasons, but one of the reasons can be that when the mind thinks how much I have been humiliated and how much affect should I generate in response, the infinity there comes in, as though I have been infinitely humiliated and I should generate infinite sadness, anger, and desire for revenge. Right? There is no calibrated bottom to it. It's just an infinity opens up. And whatever maximum is possible in that system, the maximum effect is generated.
It is the magnified, exaggerated, disproportionate quantum, which is the infinity of the effect here.
So the upper limit of generation of affect is decided only by the system limit, not by the calibration of response, because the infinity has opened up.
Right.
Whereas if the calibration of response is in operation, the infinity won't open up. And we see that in most cases, the difficulty is in catastrophic thinking or in disproportionate generation of affect. And this is where, instead of a rational calibrated mechanism, infinity has opened up in the evaluation process. So these two are very important elements in Bion's ideas.
Just for further understanding, I now understand what is the infinity in this Bionian concept. This infinity is created by the psyche only, or the container outside? Who's the demarker for the effect generated here?
It can be precipitated by many factors. Narcissism can be one of it. And the learned response from the primary caregivers can be the second component of it. If the primary caregivers themselves are hysterical, disproportionately reacting, then the same kind of infinity develops in the person. In simple language, there used to be an old saying in psychotherapy that neurotic parents breed neurotic children. One of the mechanisms through which it happens is this. Hello?
Yes, sir. Yes,
yeah.
sir.
Yeah.
So as you were talking about frustration, which is the pre-context or the smaller version of sadness, similarly, irritation can be that for anger.
Yeah, correct. Frustration can precede both actually, anger and sadness. It can also precede irritation in some cases. In many cases, I would say.
You also mentioned the O, the ineffable O of Bion's.
Yeah, that is a separate component, because from the significance of containing, Bion moved onto the ineffable O. So the containing went from passive containing to active containing to a positive healing containing. And that graduated into the state of ineffable O, where the therapist does not make a conspicuous or active intervention, but there is a active containment inside in the state of silence, in the state of silence. And that almost is a spiritual state into which the therapist gets into. And in that state of silence, somehow the healing of the patient happens. Almost as though the patient internalizes some part of it or uses the system of the therapist to process out what is otherwise difficult to process. And in some strange way, the healing happens. And this process, which happens in the patient, by which the healing happens, is the ineffable O, where Bion says it cannot be described, but its after effects can be felt in terms of the healing. And this is a very mystical state and a mystical process of healing, which again is one of the mystical Bionian concepts. And in Bion, we find Bion in two parts, the early Bion and the late Bion. The early Bion is very rational, developing the Kleinian thought further. So he is going into envy, into attacks on linking, into the grid, into love, hatred, and minus k, into the alpha and beta functions, and the later Bion, which is going into the ineffable O.
So is this ineffable O parallel to Kleinian's oceanic fusion?
No, but there are two elements of it. There is definitely an element of a very subtle and productive fusion, and there is also an element of the peace, the bliss, and the salutariness in a microwave in this state of ineffable O in the therapist, which produces the
It's
ineffable O
miniature.
in the patient. Huh? Sorry?
We can say it's a miniature glimpse of oceanic fusion.
Yeah, it has elements of it in a
Elements.
oh yeah, in a small proportion, but in a very productive combination.
It can be an ultimate goal in Bionian concept of therapy in some of the sessions.
Yes. In fact, I try to use it in most of my sessions for some minutes. And many times it happens by itself. Many times I wait for it to happen. Many times I try to make it happen to the extent I can.
And how about Kant's work around it, the workables he would contribute towards this epigenesis?
Kant did not go into the ineffable O or the difficulties of thinking, or the fact that we learn thinking in a mutual process, and we need a container to develop the capacity to undergo that full process. We'll come to it in a moment, but let us go to the manufacturing process of Bion, and then we can move on to Kant from there.
All right.
So when the child cries and there is this nameless state, the mother gives a name. Now the process by which the state of the child is felt by the mother, because of which she is able to give the right answer, is a process of projective identification. And the projective identification is made by the child, and the mother has to be in a receptive state of maternal reverie, as Winnicott called it, to really be accepting to that projective identification. Right? And when the mother is capable enough of accepting it, processing it, and giving it back, the child gets into that right name. So this containment and giving back enables the child to develop the alpha function and also to feel. Now what happens is ki, in most people, the cognitive component of this develops well, of naming, of thinking, but the affective function may not be equally developed. So they have found containment specific to cognitive interactions, the cognitive naming, but not related to the affective component of it. So the mother was a good container and a good processor and good giving back person on the cognitive front, but not on the affective front. And worst is, she is not good in either of the things. Now, if the other half of the, it's almost like what is important here beyond is this, it's like thinking is happening in two components, right? The child and the mother. It's not happening only in the child, which is how normally we think about in psychoanalysis. It's the mind of the child, but the mind of the child actually is borrowing the thinking capacity of the mother. So it's a two body thinking, not a one body thinking. It's like a machine in two parts.
Space.
Yeah, it's a machine in two parts. And unless both the parts are there, the system is not working. Just as...
Which is very similar to the therapy room later on.
That is what happens.
Extended side.
Yeah, that the person can use the therapist as a person, as a second part of the system, to think out the unthinkable by himself otherwise. So this is a very different idea about the processing of thought and affect, about manufacture of thought and affect. That it's actually a two-body thing, it's not a one-body thing. And you are actually borrowing the body and the capacity of the other till your capacity is developed. And this is what often happens in therapy, that the therapist's capabilities are borrowed in a way till the capacity is internalized by the person. And that internalization may be affected by many other factors, including how much is the negative effect, how much is the ability to tolerate it, and so on. So this containing, processing, giving back is a very important component of therapy. And it can go into a much higher domain where it's happening silently related to the ineffable O. That there is containing, there is processing, there is giving back of the healthy processed material, but it happens silently without any verbal intervention. It's the process of that ineffable O, the non-verbal part of therapy. Of course, the non-verbal part of therapy is a large area, but in it, a very important area is this, the area that facilitates the ineffable O. Are you having a question, or should I move on to the compare contrast?
No, I'm just absorbing what you have shared. It's beautiful.
Okay. Okay. Then I would move into the compare contrast of Kant and Bion.
Yes, sir. We can have the Kant's concept.
Yeah. If you compare contrast, then Kant takes for granted that the thinking function, the feeling function can happen all by itself in a single individual, and the capacity is almost inborn. So the Kant's process of sensation, perception, conception, knowledge, wisdom is a process which is post-development of capacity to think and feel. And this process will go on if it is not attacked by attacks of linking, and also not attacked by narcissistic rage, which I have found out also indulges in attacks on linking. So Bion has put forward envy as the one who attacks the linking process. I have discovered one more factor, narcissistic rage. It is rage at the world because the world is not my world. So apart from Bion's envy, I have also discovered the narcissistic rage, which can produce attacks on linking. So Kant does not factor in that this can lead to an arrest at the level of his sensations. What Kant says, sensation, conception, sensation itself at that stage you can get fixated and just be with those beta elements if the attacks on linking and other difficulties are there. So in a way, unless the Bionian demands are met, the capacity to think or the capacity for the Kantian process to proceed gets arrested. It gets fixated there. Now, the second part is about self-soothing. That if you don't find good containers, not only the thinking function and the feeling function is underdeveloped or not rightly developed, the self-soothing also comes in doubt. Because if the primary container does not have adequate soothing capacity, you don't develop soothing capacity inside of you. And that is a problem for many, that the self-soothing is not there. It can neither be developed in that containing process, nor it can be developed in an introjective process, nor it can be developed as an emulation in learning process. And that creates very low threshold to bear affect. And the moment small affect is generated, it gets thrown out of the system in unhealthy ways. Projective identification, projection, hallucination, all sorts of things. Now, Kant never went into the specifics of thought, the vicissitudes of thought, the beta elements, the defensive action, and so on. He also did not go so much into the way we know our fantasies, or we know something by projective identification, because we don't think that the sensation, perception, conception process plays out in projective identification. It's a different way of knowing. So it's probably a non-Kantian way of knowing, something he never figured out. Maybe it involves the Kantian process, we don't know, doesn't seem like that. Bion also talked about resistance to knowledge. Kant never went into resistance to knowledge. He just went into the knowing process, not into the vicissitudes of it, not into the difficulties of it, not into the effect of feelings, hold of feelings on the thinking process, effect of envy or effect of rage. None of it Kant went into. Bion talked about infinity in that evaluation process of generating affect and assessing an event. Kant never went into it. The prior experience guiding later thinking in terms of unconscious memories, this is also something Kant never went into.
Can you repeat that, sir?
Sorry?
Can you repeat?
The unconscious affective difficulties affecting later cognitive processes.
Okay.
Let me give an example to make it easy. One thing that we see often in psychoanalysis is, let us say somebody has an obsession. The person comes to therapy. The Oedipus comes up, let us say is greatly resolved or fully resolved, and the person is greatly relieved or fully relieved of the obsession. A very normal Freudian way of dealing with things. Or let us say a person comes to a Kleinian therapist with obsession. The split is closed over a period of therapy and the obsession goes. Now what is happening is, the obsessive thought, which is a cognitive process in some way, was happening because of an unresolved unconscious affect,
Right.
be it of the split or of the Oedipus. The moment the unconscious phenomena is solved, the affect is released, right? Those thoughts cease. Which means the unconscious bottled up affect has a great effect on the cognitive process, on the thinking, the way it happens. Right?
Right.
So the obsessive thinking is not free from the bottled up unconscious affect. Those kind of relationships, that unconscious bottled up affect, can have an effect on future thought till it is released and dissolved in the unconscious. That kind of areas Kant never went into, primarily because he was a philosopher, not a therapist. So these are some of the compare contrast things. The best part was both of them liked epistemology, both of them liked and said something in their own ways about the manufacturing process of thought and affect. And in Hindi spirituality, we find many other techniques which go into the reconstruction and manufacturing of thoughts and affects and how to overcome it.
When you talked about Kant's understanding of stimulus and sensations, when we talked about Bion's part of beta particles having a conducive environment created by alpha elements, is it very similar to how neurologists would explain about schema? Because the pathway sounds very similar, because it is the pre-thought and the first state when there is an understanding and learning and knowing happening. There is a schema. Is it very parallel in the neurology, will it be parallel somewhere, these two concepts, what Kant and Bion has given?
They will meet at some point with many conditions added, but the core belief kind of thing is macro compared to this. This is more fundamental.
This is more fundamental.
The core belief kind of thing, the where you can come in CBT to the roots, this is below those roots. So the bottom part, the bottommost point of CBT is still the terrace of this building.
These are the elemental forms of those beliefs.
Yeah, because
how their
regardless of whether
combination of belief.
Regardless of whether the core belief is healthy or unhealthy, right? The core belief is a finished form of thought. And we are going into the manufacturing process of thought, which is below it, the result of which will be a thought, healthy or unhealthy. So if there is a core belief, it is a thought of some sort. Now, below it is its manufacturing process, the result of which is this. So we are going into the manufacturing.
I talked about the schema, not of CBT, of neurology, where a child sees and understands a concept of anything into the learning process.
Yeah. So if you go into the Immanuel Kant's categories, then at that level, the two will coincide. Because Kant's elemental categories will have a corresponding neurological process and even a neurological structure, which presently we may not. Similarly, if you go into the neurology of the Bionian process, that also you will find a very elemental neurological process. And you will also see a confluence of both the neurological processes at some point.
Right.
So when we get into the neurology of epistemology and beyond, it will be at a very deep level, very elemental level, and there will be confluence of the two on some points.
So coming back to Bion, how can we see his theory of manufacturing process of thought or effect?
We explained, we went into this before, that the nameless state is stabilized by the mother giving a name.
Right.
And over a period of time, the child learns the same thing of how to give a name itself. Right? And this actually leads to that internalization of the alpha function.
Okay.
So when we look at internalization as a process, many things are internalized. Internalize an object, you can internalize a situation, you can internalize the way defenses have to be used in particular situations. Many things can be internalized. One of the things that can be internalized is the alpha function. And that may be internalization, or that may be part internalization and part development from within. We don't know exactly how it happens, because still at that level, we are talking metaphorically. We are still not anywhere near to the neurology of it. So the that internalization process, it also requires a good, reliable, stable object. A good, reliable, stable object is a great facilitator of the way the alpha function gets internalized, because alpha function can get internalized with different caregivers in many different ways based upon the interplay of the constitution and the person. So many people would have very successful internalization of the alpha function, and yet they can have very dysfunctional thinking patterns. That the problem is not in thinking, but the flavor and color of thinking. And the worst would be difficulty in the function itself, not in the color and flavor of the function. So this is how the whole elemental process happens.
So on alienation, is Bion not less of an alienist compared to Kant?
In degree, yes. In Kant, you see complete alienation because you have an independent subject and object. And the subject and object both are not linked in any grand purpose or design. They are just two isolated entities. That the subject finds the object in this world and we don't know why, but it happens so. And we accept it as it is without an answer to it. Now,
what is the object here?
Any object of knowing and the knowing subject. So there is the knowing subject and the object. The knowing subject is trying to know. And there is no connection between them except the transfer of stimulus.
Oh.
But in that sense, and it's a very isolationist view of the individual and nature and the way processes work. So Kant is a full-blown product of modernity. And one of the core elements of modernity is isolationism. That every system is cut off and independent on its own. It does not see any organic unity between systems. So Kant is a product very much of that modernity and therefore completely isolationist. And this raises alienation to its peak because then the subject has no connection whatsoever with nature or the universe. He is just an isolated subject who finds himself in the universe with a capacity to know and is trying to know. And the knowing is limited. There is no way he can know the purpose. There is no way he can know the world actually as it is. He can only know as it appears to him. So he can never know, as Kant says, thing in itself. He can only know thing as it appears to him. Like if somebody had, instead of 5 senses, somebody had 50 senses, what an object would appear to him, we just don't know. So our knowledge is unique and specific to our species. There is no absoluteness to our knowledge. It's relative to our species. And therefore, we know the world only to the extent the apparatus of knowing of our species allows us to know. We can never know absolutely what the thing is in itself. So there is no knowledge of thing in itself. We only have knowledge that is humanly possible given our apparatus and senses, how it appears to us. So our knowledge is the knowledge of appearances, not of absolute reality. So Kant in that sense is an absolute alienist. Not that he intends, but his theory inevitably leads there. Bion is less of it. He brings in the other, where the two function as a unit. Very early in life, in order for the alpha function of the caregiver to process the beta elements of the care receiver. So in that sense, he is less of an alienist, but he is still a product of modernity. He is not somebody like Hegel, who would talk about the organic unity of the universe or a purpose of universe or a connectedness of man and nature or each individual to each other. So while he is less alienating, less modernist than Kant, he is definitely a modernist. The difference is of degree. He is not a Hegel. And the oneness that can bring about an end to alienation to some degree or maybe completely is something that you see in Hindu spirituality and in many indigenous cultures, not in either Kant or in Bion.
It was a very deep and interesting discussion for me and for our viewers for sure. Thank you, Dr. Vaidya. Namaste.
Namaste.